Is there any seat for you inside? No. The question is, so who is? Director is the DG there. Media, we said. Okay. Okay.
Somebody should be getting the names.
We have that.
We'll be checking. Yes, ma'am.
We need everybody to be seated.
No, I'm there.
Please have your seats, sir, because we want everybody ready. Water comes into this. Sound check. Our colleagues online, can you please confirm you can hear us? We will be commencing the proceedings shortly, so we await the arrival of the Honorable Coordinating Minister of Health and Social Welfare. Please bear with us. Please, can we kindly appeal to us? This room is going to get really congested, and the air conditioning system will not be performing optimally if people keep entering and they are standing. If you don't have a seat in the room, can you please excuse? This room is going to get hot, and it will be to our best interest. People are coming in, standing, will not be the best. Please bear with us. Announcing the arrival of the Honorable Coordinating Minister of Health and Social Welfare, Professor Hali Pate. May we please rise for the national anthem. Media, can you please give space for the screen? Who is doing this? This is the last stanza. Let's go to the first, please. Is the right one, but it's the last stanza. We help. Abandon without stay. Last stanza. O God of all creation, And these are one request. Help us to build a nation where no one is oppressed. And so, with peace and plenty, Nigeria may be blessed. Honorable Minister, while we are still standing, the protocol is to have the third stanza as the national prayer, according to the national orientation. Oh, it's already sorted. We may please have a seat. Thank you very much, very distinguished. I was just trying to understand we have already sung it as prayer, so let's move on. Thank you very much, the Honorable Coordinating Minister of Health and Social Welfare, Professor Harley Patti. We have been joined in this very important meeting by the representative of the Honorable Minister of Agriculture and Food Security, and that's the Director of Planning and Policy Coordination of the Federal Ministry of Agriculture and Food Security in Abuja here, and that's the person of Ibrahim Tanimun. A round of applause for him, please. Here with us representing the Honorable Minister of Environment from the Federal Ministry of Environment. Here with us is the Director of Pollution Control and Environmental Health, in no other one than Engineer Mrs. Baijaho Abubakar. A round of applause for her, please. Honorable Minister, as we move on into today's proceedings, it's my honor to go on to the next item on this agenda, as we also take the welcome remarks by the Permanent Secretary, Federal Ministry of Health and Social Welfare. We need to move the microphone around. Please bear with us. Do we have a spare one?
The Honorable Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Patti, representatives of the Honorable Ministers of Agriculture and Environment, the directors of the ministry here present, DG of NCDC and staff of NCDC, our development partners, distinguished ladies and gentlemen, members of the press, good afternoon. It is an honor and privilege for me to welcome you all to this official unveiling of the One Health National Action Plan on Antimicrobial Resistance and the Genomics Surveillance Strategy. This event marks a significant milestone in our collective effort to safeguard public health, protect our ecosystems, and promote sustainable development. This One Health approach recognizes the interconnectedness of human, animal, and environmental health, highlighting the need for a collaborative response to emerging health threats like antimicrobial resistance. As we confront the growing challenge of drug-resistant infections, the significance of this initiative cannot be overstated. AMR threatens to revise decades of progress in healthcare and agriculture, putting countless lives at risk. Through this action plan and the genomic surveillance strategy, we are enhancing our national capacity to monitor, prevent, and respond to AMR effectively. Distinguished ladies and gentlemen, I want to commend all our stakeholders who contributed to the development of these policy documents. WHO, but first of all, NCDC, WHO, WOAH, and all our partners who have helped us in this. Your dedication is vital to the success of this initiative. And as we move forward, I encourage each and every one of us to stay committed to the implementation of this plan, working together to combat AMR and place the health of our people, animals, and environment in safe hands. Thank you for your kind attention, and you're all welcome.
That's been the voice of Daju Kacholom, MNI, the Permanent Secretary of the Federal Ministry of Health and Social Welfare. Moving on to the next item on this agenda is the remarks. The opening remark of the Director General, Nigeria Center for Disease Control, Dr. Jide Idris. A round of applause for the DJ, please.
The Honorable Coordinating Minister for Health and Social Welfare, can I say distinguished ladies and gentlemen, colleagues and partners, let me say that your presence here today reflects the shared commitment we have together, addressing one of the most pressing health threats of our time. For many years, we have discussed the growing danger of AMR. We have held meetings, participated in workshops, and formulated action plans. These conversations have been crucial in raising awareness, building partnerships, and laying the groundwork for the progress we aim to achieve. But today, we must recognize that the time for talk has passed. Now is the time to move from dialogue to action and from strategy to implementation. AMR continues to grow, claiming lives, threatening livelihoods, and weakening our health systems. To turn the tide, we must translate our plans into tangible results. The launch of the One Health National Action Plan on AMR and the National Genomic Surveillance Strategy is a call to action, a signal that we are ready to advance beyond discussions and drive meaningful change on the ground. We must now focus on real-world implementation. Embedding AMR interventions in every level of our healthcare system, building robust surveillance and laboratory networks, and ensuring that frontline health workers have the tools and resources to act decisively. The National Genomic Surveillance Strategy provides us with the opportunity to not only detect resistance, but to anticipate and respond swiftly, preventing the spread of resistant infections before they escalate. I urge everyone here today to commit to a new phase of determined action. We cannot afford delays or half measures. The stakes are too high. Let us collectively embrace a culture of accountability, ensuring that the plans we launch today translate into measurable impacts on the health and well-being of our communities. I'm confident that with our combined efforts, we will move beyond conversations and set a new standard of tackling AMR, one that prioritizes implementation and drives sustainable change. I thank you for your dedication, and let's continue to turn our shared vision into reality. Thank you very much.
Thank you very much, our Director General, Nigeria Center for Disease Control. Moving on, we have the formal remarks on behalf of the Ministry of Agriculture and Food Security. My pleasure to hand over the microphone to Ibrahim Tanimo, representing the Honorable Minister. Over to you, sir.
The Honorable Minister of Health and Coordinating Minister, the representative of the Minister of Environment, the Permanent Secretary, invited guests, stakeholders, directors, media, ladies and gentlemen, good evening. Let me start by extending the Honorable Minister's apology for his inability to be here and to present his remarks here. We are here today at a critical juncture in our global health efforts, where the challenge of antimicrobial resistance poses an essential threat to the progress we have made in public health, food security, and sustainable development. In line with the political declaration at the just concluded United Nations General Assembly, the Federal Ministry of Agriculture and Food Security recognized the antimicrobial resistance as one of the most urgent global health threats and development challenges. Distinguished ladies and gentlemen, a study on the global burden of bacterial antimicrobial resistance in 2019 revealed that 64,500 deaths were attributable directly to antimicrobial resistance, while over 263,400 deaths were associated with AMR. Of concern is the fact that the globally antibacterial resistance is estimated to cause losses of about $1 trillion and 3.4 trillion of global gross domestic product per year. Antimicrobial resistance is also predicted to cause about 11% of decline in livestock productivity and low-income countries by 2050. Distinguished ladies and gentlemen, the Federal Ministry of Agriculture and Food Security is committed to strengthening and accelerating multi-sectoral progress through existing One Health governance structure at the national and sub-national levels. To curb antimicrobial resistance, the Ministry has established a network of laboratories to support AMR surveillance, develop national guidelines for the use of antimicrobial drugs in animals to guide animal health practitioners. In this connection, in collaboration with the Federal Food and Agriculture Organization, the Ministry has developed biosecurity guidelines and standard operating procedures for poultry, aquaculture sectors. These all speak to the National Action Plan. Ladies and gentlemen, it is evident that the National Action Plan has 6 strategic objectives with implementation plan aim at addressing the challenges of antimicrobial resistance in the human and animal environmental sectors. The Ministry of Agriculture and Food Security pledges its full commitment to the implementation of the activities of the National Action Plan. Finally, while acknowledging the efforts of development partners such as Food and Agriculture Organization, World Health Organization, and World Organization for Animal Health, as well as donor agencies such as the Fleming Fund in the fight against antimicrobial diseases, it is evident from the Graham report of 2019 that the burden of antimicrobial resistance is largely and disproportionately borne by developing countries and those in the vulnerable situations. This requires global solidarity, joint effort, and international cooperation. It is worthy of note that the new NAP 2.0 is costed with a monitoring and evaluation framework, which makes it an effective tool for resource mobilization. I hereby call on all development partners and donor agencies to support Nigeria in the fight against antimicrobial diseases. Also, I want to commend the efforts of the management of Federal Ministry of Health and Welfare for providing such required leadership and coordination of antimicrobial resistance against using the One Health approach. Thank you very much.
Thank you very much, the representative of the Honorable Minister, Federal Ministry of Agriculture and Food Security. Moving on, presenting formal remarks on behalf of the Federal Ministry of Environment. Here with us seated is the Director of Pollution Control and Environmental Health, Engineer Mrs. Baijatu Abubakar, FNSA. Your Honor.
Thank you very much, MC. Honorable Minister, first and foremost, express our Honorable Minister's regret for not being here. He's currently in Zaria, rushing back to also head for Samoa. The Honorable Minister of State is on board a flight from Ondo, and he actually promised that he'll head from the airport, and hopefully he'll catch us before we finish. So I bring the apologies of the Federal Ministry of Environment. Honorable Coordinating Minister, sir, the representative of the Honorable Minister of Agriculture, my dear sister, the Permanent Secretary, DG NCDC, directors, development partners here present. Good evening to all of you. I bring you greetings from the Honorable Minister of Environment, Malam Balarabe Abbas Lawal. And here I read his remarks. It is my pleasure to join you all today to this auspicious occasion. Today's event is a crucial step forward in our collective fight against microbial resistance, AMR. As this revised One Health National Action Plan on Antimicrobial Resistance, AMR NAP 2.0 builds upon the successes and lessons learned from the first version. Distinguished ladies and gentlemen, as you are all aware, AMR poses a formidable threat to national and global health security, food systems, as well as economic development. The UN Ad Hoc Interagency Coordinating Group on Antimicrobial Resistance warns that if no action is taken, antimicrobial resistance scourge could claim up to 10 million lives annually by 2050 and damage the economy as catastrophic as the 2008 and 2009 global financial crisis. Also, AMR could force up to 24 million people into extreme poverty by 2030. To address this challenge, our AMR NAP 2.0 and this first national genomic surveillance strategy, as well as the AMR policy for the environment sector, have outlined strategic interventions, and this requires integrated and multi-sectoral approach. Effective implementation of the plan will improve the country's strategies of addressing antimicrobial use and strengthening AMR surveillance in the environment sector, livestock, and also healthcare settings, while promoting sustainable standard practices that ensures food security, protection of the environment, and human health. The Federal Ministry of Environment, through the Department of Pollution Control and Environmental Health, have learned a strategic lesson through our intervention on early warning systems during the floods. And this actually made the Honorable Minister to launch an emergency response team. This emergency response team, which I'm actually heading, is meant to check environmental health emergencies and respond with all relevant government agencies. And I'm sure that this will fall in line with what we're launching today. As we embark on this journey, which begins with this launch, I therefore urge all the One Health partners, MDAs, and stakeholders to join forces to preserve antimicrobials for future generations, enhance food security, and protect our environment and our health. Once again, I welcome you all to this launch, and may our collaboration and commitment yield remarkable results. Thank you.
Engineer Mrs. Bajatu Abubakar, FNSC, thank you so very much on behalf of the Honorable Minister of Environment. Speaking about partners collaboration, it's been a long walk on this journey. It's now left for us to receive goodwill messages. I've been asked to kindly appeal to us to please stick to less than 2 minutes in the interest of our time. To start this conversation on the goodwill messages is the World Health Organization representative for Nigeria, in person of Dr. Walter Kazadi Mulombo. WR, please.
Honorable Coordinating Minister of Health and Social Welfare, honorable ministers and representatives, distinguished guests and invitees, please allow me to stand by existing protocol. I would like to take this opportunity, Honorable Coordinating Minister, to congratulate you and Minister of Health, Minister of Agriculture and Food Safety, Minister of Environment, and through you, the rest of the government for achieving this milestone just in the aftermath of the United Nations General Assembly, where AMR was high on the agenda. It shows really the leadership, the ownership, and the drive we want to see in this era. I would like to take this opportunity to underscore that antimicrobial resistance is the most urgent need and threat to health, economy, and development of our time. Now, as a matter of fact, antimicrobial resistance is predicted to be the cause of the next pandemic. It will remain unaddressed. Previous speakers mentioned the burden in terms of number of deaths, and indeed it's predicted that if we do nothing in the next 25 years or so, we'll have more than 39 million deaths just for antimicrobial resistance. That, in addition to other economic outcome. And I would like to emphasize that antimicrobial resistance impacts several SDGs, not just SDG 3. It indeed affects beyond SDG 3, which addresses human health, SDG 1, no poverty, SDG 2, zero hunger, SDG 8, decent work and economic growth, and many others. So a very, very wide range of consequences. We have observed through the recent analysis moderate to high level of resistance to different antibiotics that we use, including those that we reserve as second or third line when the first line failed, what we call antibiotic on the watch and reserve list. Antimicrobial resistance has a number of challenges which are actually multifaceted. And to tackle them, we not only need multi-sectoral One Health approach, but an integrative and multidimensional approach to address the wide range of risk factors, from irrational use of antibiotics to indiscriminate antibiotic use, irrational consumption, lack of access to clean water, sanitation, and many others. And of the 177 countries that have currently developed the NAPs on AMR, only 11% have made provision for funding the development of their plan. So we are happy that Nigeria is not among them, but it's also a call for the government, but also with the partners to invest really in antimicrobial resistance and address root causes. I want to take this opportunity to really congratulate the NCDC and partners and all stakeholders for effort to come up with the National Action Plan on AMR. Let me appreciate also and congratulate all those involved, as the process of developing the NAP 2.0 was unique in this country. It spanned over 14 months of hard work, inclusive of core 7 sectors who participated actively, and that resulted in mapping over 120 experts and stakeholders, including the private sector, academia, NGOs, and others, to support implementation and development of the Plan 2.0. This is also an opportunity for us to express our commitment as quadripartite with UNEP, FAO, World Organization of Animal Health, and WHO to continue to work along the quadripartite of the One Health approach here in Nigeria, ably led by the Coordinating Minister of Health and Social Welfare. We, as a UN, we remain committed to supporting acceleration of its implementation for the next 5 years in the spirit of the SWAP and the health sector renewal investment initiative. I think it's time to really take action, because if we don't address antimicrobial resistance in Nigeria, it can jeopardize health of Africa and the world. We cannot achieve universal health coverage without tackling antimicrobial resistance. So on this note, I really want to congratulate again the Honorable Coordinating Minister, the other ministers, and all the partners who contributed to this achievement. But the plan is just a plan. If we leave it in the shelf, we'll never address antimicrobial resistance. So I would like to express our commitment to work alongside the government to really address this issue that threatens the whole world and could trigger the next pandemic. Thank you for your attention.
Thank you very much, WR, for those great message. Moving on, as the Goodwill message on behalf of Food Agriculture Organization, FAO, and speaking is Dr. Ayodele Majekodumi, the coordinator of FAO Emergency Center for Transboundary Animal Disease. Dr. Ayo, you have the floor.
Good afternoon, Honorable Coordinating Minister for Health and Social Welfare, representatives of the Honorable Ministers of Agriculture and Environment, the Director General of NCDC, the WHO representative, and distinguished ladies and gentlemen. I bring you greetings from the FAO representative to Nigeria and ECOWAS, Mr. Kofi Kwaku. AMR is a global health priority with significant negative effects across human, animal, and environmental health, as well as agriculture and other sectors which contribute to household and national economies. Agri-food systems in particular are a significant contributor to both antimicrobial use and antimicrobial resistance worldwide, as we have heard. The Food and Agriculture Organization of the United Nations leads global efforts to mitigate these negative effects of AMR in agri-food systems, particularly in plant and animal health. And FAO Nigeria, through its Emergency Center for Transboundary Animal Diseases, is proud to have supported the government of Nigeria in the preparation of this very robust national action plan, which will guide all our efforts to prevent and control AMR over the next 5 years. We particularly want to congratulate all those that were involved in the preparation for the significant One Health cooperation that was demonstrated during the preparation of this National Action Plan. At FAO, we remain committed to supporting Nigeria in the fight against AMR through implementation of the National Action Plan for Antimicrobial Resistance. Please accept our congratulations on achieving this milestone, and we look forward to working together with the government of Nigeria and all partners here present to make further progress in mitigating the effects of AMR. Thank you very much.
Thank you very much, Representative FAO. I've been asked to please kindly appeal that we stick to less than 2 minutes for our speeches so we could tidy this up in no time. Speaking on behalf of the Clean Thin Health Access Initiative, I will be coming to that shortly. The Honorable Minister, sir, we crave indulgence. There's an online goodwill message from the Global Fund country team, and I will kindly crave your indulgence if we can have it, sir. Your permission. Media, please let's connect Global Fund. Okay, if that's the taking, okay, is it ready? Thank you very much, Jean Thomas, on behalf of the Global Fund country team. Moving on, as we conclude this round of goodwill messages, I'd like to recognize the Director, USAID, here in Nigeria, in person of Melissa Jones, for the goodwill message on behalf of USAID. You have the mic, Mom.
Thank you very much. Coordinating Minister for Health and Social Welfare, representatives from the Ministry of Environment and the Ministry of Agriculture, the Director General of the Nigerian Center for Disease Control, representatives or from multilaterals, foundations, and bilateral donors, members of the press, distinguished guests. Good afternoon. I am pleased to be here on behalf of the United States, the American people, and of course, USAID, to support the One Health National Action Plan 2.0 on AMR and the National Genomic Surveillance Strategy. The launch is very important and very timely. You know, in a time where drug resistance plagues our hospital wards, where climate change and deforestation are bringing animals and humans closer together, where our neighboring countries throughout Africa and elsewhere are facing infectious diseases of zoonotic origins, this is timely. And we'd like to acknowledge the leadership of the One Health Steering Committee, as well as the Technical Working Group on AMR, and all of our collective efforts and plans that are dedicated and bring forward action to this very important issue. USAID is delighted to see such rapid action in addressing the Joint External Evaluation Report. The launch of this document is crucial in providing strategic direction on what the country should focus on with respect to AMR and antimicrobial stewardship that will move the country's capacity to the next level. We acknowledge the hard work that went into developing of this document and the approach that recognizes the interconnectedness of human, animal, and environmental health. Through our implementing partners, MTAPS, FAO, Breakthrough Action, and the core group for polio programs, we continue to support the technical actions of the One Health Technical Committee, and we appreciate the collaboration of the NCDC to develop some of the documents that are launched today. We look forward to continuing collaboration with the respective ministries, departments, and agencies through our technical offices and partners. This work not only impacts Nigeria, it impacts Africa, and it impacts the world. We are here today to continue to finance some of these important bilateral and multilateral organizations that provide such critical support. So thank you on behalf of the American people.
Welcome my former boss, former Honorable Minister, Professor Christian Onyebuchichukwu, who has just joined us, who is a member of the Global Leaders Group on Antimicrobial Resistance and the chair of the AMR Committee of Practice. So you're welcome. We'll hear from him later, but I just wanted to welcome him.
Another round of applause for former Minister, Professor Onyebuchichukwu. Thank you for all you do for the country and the world at large. Moving on, as we directly please, now less than a minute, let's take a quick break from the representative of Clean Thin Earth Access Initiative, Dr. Jibril Kamar. It's been a bit challenging with the logistics.
Honorable Coordinating Minister of Federal Ministry of Health and Social Welfare, the Honorable Minister for Environment, representative for the Honorable Minister of State for Agriculture and Food Security, Permanent Secretary for Health, our directors in the room, distinguished ladies and gentlemen, allow me to stand on all existing protocols. I bring you greetings from the leadership of the Clinton Health Access Initiative. Today we gather to celebrate a pivotal achievement in our journey towards enhancing public health in Nigeria. With the launch of the National Genomic Sequencing Strategy and the unveiling of the AMR National Action Plan. These initiatives represent a significant step forward in our commitment to improve disease surveillance, prevention, and response. I would like to extend our sincere gratitude to the Director General of the NCDC, Dr. Gideon Idris, for his visionary leadership in reconstituting the National Genomic Surveillance Consortium and developing a National Genomic Sequencing Strategy. The dedication of the NCDC has been instrumental in bringing together a diverse coalition of stakeholders united by a common goal to strengthen our genomic capabilities for the benefits of all Nigerians. The National Genomic Sequencing Strategy embodies the principles of the One Health approach, recognizing the interconnectedness of human, animal, and environmental health. By integrating genomic data across these sectors, we can enhance our capacity to detect, prevent, and respond to emerging threats, ultimately safeguarding our communities. As we embark on this important journey, let us remain committed to collaboration, innovation, and the pursuit of excellence in genomic science. Together, we can ensure a healthier, more resilient Nigeria. Thank you very much.
Thank you very much, Representative of China. Moving on to Dr. Adella Foundation. Speaking on behalf is Niniola Williams. Over to you.
The Honorable Coordinating Minister of Health and Social Welfare, the representative of the Honorable Minister of Agriculture and Food Security, representative of the Honorable Minister of Environment, Permanent Secretary, Director General NCDC, development partners, media, and all invited guests, good evening. Greetings from the public health organization DRASA Health Trust. DRASA stands for Dr. Ameo Stella Adadevo, the doctor who died after identifying and containing Nigeria's first Ebola patient in 2014. She was my aunt. I stand here today as DRASA played a key role in the development of this One Health National Action Plan 2.0. From supporting the situational analysis and facilitating the NAP development process, to reviewing the policy brief, we have been part of this journey from the beginning, working alongside the One Health stakeholders to ensure Nigeria's NAP reflects the dedication, diligence, shared responsibility, and collaborative spirit of everybody that was involved. The process was as participatory and consultative as it was very intense and thorough, and many of the colleagues in this room who were part of the journey can attest to that. As a result, the comprehensive and integrated strategies of our NAP, which are costed and measurable, by the way, showcase our nation's commitment to safeguarding the health, well-being, and the livelihoods of its population. This is something we should be very proud of. AMR is no longer just a threat in Nigeria. It goes beyond numbers, and it has many faces. From the babies in Kano and Abuja, born with colistin-resistant bacteria, to the communities in southwestern Nigeria with water sources containing antibiotic-resistant genes, to the poultry meat that's harboring potentially resistant salmonella. AMR is here with us, and it is real. Facilitating the development of this 5-year National Action Plan for AMR was a privilege, and I'm pleased to see Nigeria taking this momentous step to celebrate its launch. As an indigenous development partner here in Nigeria, we at DRASA are committed to our continual support of this NAP and our support of the One Health ministries and all stakeholders as we continue working together to tackle the menace of AMR. Congratulations to all of us, and now there's a lot of work to do, so let's get to it. Thank you.
Thank you very much, DRASA representative, and thank you so much for all you do. Honorable Coordinating Minister of Health is now left for us to go into the meat of this conversation. As I receive Professor Kabir Junaid, may I kindly request that members of the press, you may want to move the cameras to the side so that we can see the screen for ease of visibility. Introducing the AMR National Action Plan 2.0 and the situation analysis is no other person than Professor Kabir Junaid, the co-chair, Antimicrobial Resistance Technical Working Group.
Prof, you have the floor, please.
Honorable Coordinating Minister of Health and Social Welfare, representatives of the Ministers of Agriculture and Food Security, and the Minister of the Environment. A special greeting to you, Honorable Minister, sir, and I stand on all existing protocols. I protested that I was given only 5 minutes, because I wish we have time to dwell on all the things that happened that culminated in the development of this National Action Plan, and all those great Nigerians and the friends of Nigeria that have contributed in this effort. Nigeria realized that AMR is important a long time ago, and the NCDC, together with the other 3 sectors of the One Health partner family, worked and developed the NAP1 as early as 2017. And we recorded remarkable achievements from NAP1 to NAP2. NAP1 expired in 2022, and we began the process of developing the second phase of our battle against AMR in Nigeria. And as early as that time, the One Health Partnership undertook a situational analysis with support from our partners, and at that time brought out really the not so pleasant situation of AMR in Nigeria. And I'm sorry to say, Honorable Minister, sir, from the time that situational analysis was undertaken to now, even things have gotten worse. And it was important. One of the realizations during the implementation of NAP1 is we also had some challenges in working together as a One Health team. And an effective leadership, multi-sectoral collaboration, skill training, special training was undertaken to improve our interpersonal skills and capacities to work as a team in Nigeria. And I think that is an important achievement. And subsequently, a stakeholder mapping was undertaken. We had several series of workshops, online and physical, and eventually the child is born today. And we are here to celebrate. The situational analysis, as I mentioned, brought out how vulnerable Nigeria is in terms of AMR. And of course, for our size as a country, and for the diversity of our ecology, and for the complexity of our sociology, Nigeria is bound to face problems like AMR. The existing data showed that up to 64,500 deaths were recorded due to AMR. And we are still battling with environmental problems like open defecation. And collectively, these issues with other confounders are bound to accelerate the problem of AMR. Next slide, please. The situational analysis also brought out specific information about the fact that Nigerian drug resistant index in the human health sectors is above 65%, which is higher than the threshold of 25%. In the animal health sector, a lot of data was analyzed that showed that we have a variety of multi-drug resistant bacteria that are available in the food chain, in various animal species, and in animal processing facilities. And this has extended to environmental contamination, where our water, soil, remarkably contaminated with antimicrobial resistant members of the enterobacteriaceae that are derived from either the GIT of humans or animals. And we have also begun to see evidence of resistance to disinfectant that is rapidly spreading in environmental pathogens. It is also sad that our plant health sector requires massive use of pesticides, some of which have antimicrobial activity. There's a data that shows that over 70% of vegetables that we consume are contaminated with pesticides. And this is something that every responsible country would like to reverse. Next slide, please. So the plan we are looking at today envisages, hopefully, that we have a healthy nation where AMR prevention and response is prompt and is evidence-based. And the goal is to reduce, prevent, and slow the evolution of resistant organisms and the impact of humans, animals, and the ecosystem, while ensuring optimal use and improve access to effective, safe, and quality-assured antimicrobials and diagnostics for continuous successful management of infections. With this plan, some specific objectives were developed in the plan. Can we go to the next slide? And these strategic objectives include strengthening leadership and collaboration across the One Health sectors. That will ensure good governance at both national and subnational level. And taking this battle to the subnational level is something that is profoundly captured in the NAP2. The second strategic objective is to improve antimicrobial resistance awareness, education, understanding, and behavior change among all stakeholders. Improve evidence-based strengthening of One Health AMR surveillance system and operational research for decision making. And then improve implementation of infection prevention control programs, including biosecurity, particularly in animal production, use of vaccines, access to, and the practice of WASH across the One Health sectors. Then the fifth strategic objective is to improve access to quality antimicrobials and optimize their use across the One Health sectors. And finally, build knowledge and capacity of relevant stakeholders to improve local innovations, research and development in antimicrobials, diagnostics, and vaccines, and other alternatives to antimicrobials for use in man and animals. Next slide. The NAP2 is expected to cost a little over $77.6 million. And you can see that the resources are fairly shared over the very important the 6 strategic objectives. And it is pleasing to know that a lot of the money will go to improving access to quality antimicrobials and optimize their use across the One Health sector, since antimicrobial resistance is entirely driven by antimicrobial use. The next year, 2025, we'll see a massive expenditure of resources to rapidly derive the implementation of the NAP2. A little over 30% of the resources are budgeted to be expended next year, and I can assure you, Honorable Minister, that the stakeholders are ready, and these resources will be spent across the key sectors of the One Health platform, including agencies, key agencies, the NCDC, Federal Ministry of Health, Federal Ministry of Agriculture, Environment, and also other agencies of the ministry, including NAFDAC, particularly of their responsibility in the control of antimicrobial manufacturing, importation, and distribution. Honorable Minister, sir, because of time, I will conclude here. The development of the NAP2 we are presenting to you here, sir, is a result of dedication and collaboration from various stakeholders that not only were part of the implementation of NAP1, but several other stakeholders that were not part of the implementation of NAP1 that are now incorporated in the implementation of NAP2. That will ensure a robust program for the control of AMR in Nigeria and the strengthening of the One Health activity in Nigeria in order to ensure the actualization of global health security agenda of this administration and beyond. Thank you very much for listening.
Professor Kabir Junai, thank you so very much for helping to take the time. That's been a brief overview. And we move on quickly. As we know, this is a twin event. To now receive the introduction to the National Genomic Sequencing Surveillance Strategy and the journey so far. To walk us through this in less than 5 minutes, I trust Professor Mayowa Olabi. Over to you, sir.
Okay. Thank you very much. The Honorable Minister for Health, Honorable Minister of State for Agriculture and Food Security, Honorable Minister of Environment, and all other stakeholders, the DG of NCDC, and all other stakeholders present. I stand on all existing protocols. It's a great privilege to talk about the National Genomic Sequencing and Surveillance Strategy. Next slide. The process, of course, involved all stakeholders from the private sector, from the public sector, development partners, African CDC, CHAI, and so on and so forth. So we started off by looking at the landscape, did a brief situational analysis to look at the resources that are involved in the omics space, both for sequencing as well as for biorepository, as well as data science, and the pipeline, the precision product pipeline development as well. And then we had a meeting, a workshop, so to speak, initially to do a draft of the strategy, which is very, very exhaustive. I will just take us through some aspects of or elements of those. And then we also had a meeting, a validation meeting, so to speak. And this is definitely something that is multi-sectoral. A quadruple helix approach involving the private sector, academia, the public, and of course policymakers. And even within policymakers, you can see is one health approach involving multiple ministries. Next slide. Yeah, so this actually in a nutshell summarizes what we did and what is required for Nigeria to take the leadership role in leveraging the developmental value of the omics revolution, and that's genomics, proteomics, multiomics, and so on and so forth, and metabolomics, as well as the data science and artificial intelligence revolution, to be able to develop new products for solving not only the health challenges of Nigeria and other African countries, but also as a catalyst for development, and I will illustrate that. But certain things are required before we can really benefit from this. And by the way, the biotechnology industry is a multi-trillion-dollar industry that accounts for more than $1.55 trillion, and Nigeria and other African countries contribute less than 1%. And by the way, most of the health products we use, medications, devices, for prevention, for diagnosis, for treatment, for rehabilitation, in Africa, 99% are from outside Africa, only 1%. And then, by the way, Africa has the richest genomic resource because Africa is the cradle of humanity genetically. So what is happening is that a lot of other stakeholders know the value of this, and they know that by collecting these raw materials, biosamples and all of that, and using data science to transform them into discoveries, novel discoveries, if there is ever going to be a cure for some of the incurable diseases like cancer, like hypertension, like diabetes, it's going to come from genomics and omics. And we better take advantage of this to transform not only our health, but our economy. So the first step, of course, is to look at what resources are available in terms of where can we do sequencing, what are the biorepositories, and what kind of data science infrastructure do we have for use of data science, artificial intelligence, supercomputing, clusters, and all of those. And then come up with, we have a strategic plan, but we can then go into the action plan of the different components of this, and how we can use this, like I said, as a catalyst for development. One critical thing for this field is to have a political, legal, ethical, anthropological, social, and economic framework that is going to drive this, as well as community engagement and involvement, because this is going to involve, first of all, we want to use this to address all disease burden, not just infectious disease, but non-communicable diseases, which are overtaking overtaking communicable diseases as a major cause of death on the continent, and since 2019, according to GBD sources. And by the way, 1 out of every 2 or 3 adult Africans older than 46 years are hypertensive. And 1 out of every 2 Africans have either hypertension or obesity or diabetes, and those are really big issues that are neglected. Genomics can help to solve this in terms of even early diagnosis, prognosis, treatment, prevention, and even cure, and for things like sickle cell disease. But what is happening now is that for problems of Africa, the solutions like the malaria vaccine is coming from outside Africa. Sickle cell genetic engineering and treatment, CRISPR technology is coming from outside Africa. And if the cure for hypertension and other things that are plaguing Africa, if care is not taken, they will also come from Africa. And the intellectual property of the rights to the solutions that are coming from our genomes are going to belong to other people. So this is the reason why we've come up with this, to work with other partners. So the framework is important because we're going to collect One Health data, biospecimen, multidimensional One Health phenotype data, social determinants, commercial determinants of health, and so on and so forth. We also need to come up with things like, similar to UK Biobank, Genome England, all of US, like Genome Nigeria, for instance. We need to come up with something like a national genome project, okay? We also need to come up with biobanks, like longitudinal biobanks, longitudinal population study biobanks, and then bringing all of this together using the data value chain, data analytics, bioinformatics, data science, artificial intelligence. We can come up with new discoveries in terms of drugs, new discoveries in terms of how to diagnose and prognosticate, and how to cure diseases that we can sell to the rest of the world. Taking advantage of nanomedicine, synthetic biology, genetic engineering, gene therapy, and this cuts across different fields, not just health per se, but even food, like crop modeling, and of course clinical trials to try all these things out, and then implementation science and dissemination science. So in the end, this is going to cascade into transforming the well-being, wellness of Africans, as well as all the major developmental goals in terms of health, food security, and developmental impact, entrepreneurship, biotechnology, spin-off, so forth. Next slide. This is actually the most important. Next slide. Yes, next slide. Okay, so of course, to achieve this or actualize this, we will be needing the National Genomic Surveillance Consortium, which is going to be launched today. Thank you so very much.
I know very well that it must have been a great pleasure to make Prof speak within that short time with a lot of information to disseminate. Professor Mayo Alabi, Director, Center for Genomics and Precision Medicine, University of Ibadan. Round of applause for him, please. The Honorable Coordinating Minister of Health and Social Welfare, may I crave your indulgence at this point, before your speech and the launch, to receive to the microphone for his remarks the former Minister of Health. Okay, there was no social welfare at that time. And also member Global Leaders Group on AMR, Chair AMR Community of Practice, for his remarks. Professor Cheku, please.
The Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed. Many things and many good things happening. Not surprised though. We're expecting more even. Well done. Representatives of the Ministers of Agriculture and Food Security, and also the Ministry of Environment, Permanent Secretary, Federal Minister of Health and Social Welfare, Chairman, House Committee on Health Institutions, the DG, NCDC, distinguished experts, chiefs of party, of development partners here present, directors, ladies and gentlemen. I'm happy to be here for many reasons. And I want to thank the Honorable Coordinating Minister for the welcome he has given me today, and the hands of comradeship. It's like the old days when we used to be here. I want to commend first all the world leaders, including our president, who was well represented at the high-level meeting on MR at the just concluded 79th UNGA. I want to congratulate them for the political declaration. This launch of Nigeria's MR National Action Plan 2.0, as well as, of course, the National Genomic Surveillance Strategy, is highly commendable and actually indicates a decisive intention to move from commitment to action. I congratulate the leadership of all the line ministries, as well as their relevant parastatals and departments, and of course, especially our own NCDC, on the occasion of this very important launch. So on behalf of the National AMU-MR Community of Practice, I reaffirm the community's commitment towards Nigeria's attainment of the goals and targets contained in the political declaration, and in particular, the objectives in the National Action Plan. I also wish to convey the goodwill and felicitations of the Global Leaders Group on MR, led by the Right Honorable Mia Mottley, Prime Minister of Barbados. Based on the principles of One Health and working with all global and national partners, we look forward to drastically reducing MR and the attendant morbidity and mortality. We look forward not just to the costed AP, but to a fully funded NAP, as we commit to the agreed excellent stewardship in the use of antimicrobials for human health, animal health, and plant health. Hopefully, the target that's been set for global catalytic funding would even be exceeded, and targeted research will yield the expected new and effective antimicrobials. The last presentation was important. I'm excited about the prospects, Prof, of this National Genomic Surveillance Strategy. Our action, of course, must always be informed and guided by evidence. And this certainly cannot be overstressed. So once again, Honorable Minister, congratulations on the launch, and I wish you and your great team all the best. Thank you.
Yes, I'll use that. All right. My former boss, I will say, my older brother, former Minister of Health, Professor Christian Onyebuchichukwu, one of my current bosses, Right Honorable Dr. Amos Magaji, Chairman of the House Committee on the Tertiary Hospitals, Health Services. My colleagues, the Honorable Minister of Agriculture and Food Security and the Honorable Minister of Environment that are here, Permanent Secretary, Director General, Directors of the Ministry, and our development partners, WR, FAO, USAID, DRASA, CHAI, everyone, members of the press, distinguished ladies and gentlemen, today that we launch these two complementary strategic documents, the second National Action Plan on Antimicrobial Resistance and the National Whole Genome Sequencing Strategic Plan. These are essential for our collective efforts towards enhancing Nigeria's health security, which is the fourth pillar of President Bola Ahmed Tinubu's Renewed Hope Health Sector Renewal Investment Initiative to combat antimicrobial resistance and position us for enhanced national health security linked to the African regional health security and to the global health security agenda. They both represent Nigeria's unwavering commitment to its current public health challenges while preparing for the future threats that are lurking near us. It has already been mentioned that resistance is an urgent global health threat, in fact, a crisis, which if left unaddressed will lead to devastating consequences for humanity. Current estimates of 4.7 million deaths associated with bacterial AMR in 2021 alone, with 1.14 million directly attributable to AMR, I think was presented by Dr. Junaidu, who I am very pleased to see after a very long time. I've followed your work. These numbers reflect the harsh reality that resistant infections increase mortality, prolong illness, and inflate medical costs. Simple procedures such as surgeries and chemotherapy become even higher risk endeavors due to infections that no longer respond to treatment or recurrent infections. But the impact also extends beyond human health. It affects agriculture, food security, environmental sustainability. From an economic perspective, AMR imposes substantial burdens across multiple sectors with direct cost, not only in terms of healthcare cost of more than 159 billion globally, but also economic cost. Huge economic cost in terms of production of livestock, agriculture overall. So huge economic cost that is being exacted by this challenge. And Nigeria is not exempt from these risks. And just last month, we stood, as the Honourable Minister mentioned, Professor Chukwu, that President Bola Ahmed Tinubu presented through a delegation Nigeria's position at the UN high-level meeting on antimicrobial resistance. And we stood with the global community to acknowledge the profound threat of AMR, what it poses to our collective well-being. We also endorsed the high-level political declaration on AMR, which recognizes the vital role of the multi-sectoral National Action Plan as the basis for action at the country level that is based on thorough analysis of the situation and also our existing capabilities. Now, beyond the high-level political commitment, I would like to also make 2 points linked to it. One is that it needs to be backed by financing, because the threats of AMR are not limited within our borders in either Nigeria or on the continent. The developed world also can be exposed to the threat of antimicrobial resistance that happens here. So robust financing mechanisms, we need to be serious about it in terms of global cooperation to support countries implement their national action plans. Whether being very serious about things like the pandemic fund or other funding mechanisms to support countries, not only Nigeria, but other African countries and lower income countries to address it. I think it's very important that we take it seriously, given what it means for the world. The second bit is an element of the political declaration on the independent scientific panel that needs to be created so that our actions are guided by best evidence. We from Nigeria, our position is that such an independent scientific panel should be hosted in the African continent. The days of us going elsewhere to receive revealed wisdom should be behind us. We should have those independent scientific panels hosted in the continent, and I believe there are countries in Africa and scientists that are on the ground across different sectors that can do this. So this I'm saying in relation to the high-level political declaration that we supported, and the discussions are underway. And our partners that are here, I'm sure, will convey those messages. And we've heard about the first action plan, which has been implemented. Let's say half implemented, I will say, but Professor Junaidu Kabir has laid out where we are. Now we are in the second National Action Plan for AMR, which has been the product of an extensive collaboration. And I really thank you and the DG NCDC, who has anchored alongside all the stakeholders who have managed this pregnancy over time to get us to where we are, where it's battered. I think the product that we now have, which has been identified by the DG NCDC, that has clear thrust that will guide us over the next 5 years, it's really well developed. I think everyone will agree that you have done a commendable job and you put us on a path that I'm sure we will see a lot of progress ahead, focusing on things like AMR governance within the ministry, outside the ministry, public sector, private sector, and to have a coordinated whole-of-government approach that brings all sectors together to improve awareness, education, community engagement, so the population know the implication in human health, in animal health, what it means, to strengthen the surveillance system using One Health. I think the veterinary landscape is an important piece which is relevant for us. 67% of antimicrobial use is actually from the animal health sector, agriculture, outside this country, inside this country. So we succeed in human health if the animal health also is successful. And the One Health approach that we have here is something that is very clear that we need to deal with. In our facilities, the stewardship, the infection prevention and control measures, biosecurity, the vaccination efforts across not only human health but also animal health, because vaccines can help us reduce the threat of antimicrobial resistance. If you vaccinate against pneumonia, then you don't use as much antibiotics. If you vaccinate well in the animal sector, you also reduce the need for antimicrobial use, which will drive resistance. And responsible use of the existing antibiotics towards better stewardship of the antimicrobial that we have. In this ministry, I think several months ago, we did kick off the antimicrobial stewardship program, which I asked my colleague, the Honorable Minister of State, Dr. Tunji Alausa, to lead, along with several other actors, so that we use better the antibiotics that are in our hands, and to support research, innovation, and capacity building in antimicrobial development, diagnostics, and also alternatives. This, in a way, cuts into the genomics surveillance conversation the professor also laid out to us. And alongside this, the possibility of genomics really is exciting, because it potentially can revolutionize public health and medicine, precision medicine. That's an opportunity for us to leapfrog. While some may have glazed eyes when you talk about genomics, proteomics, metabolomics, precision medicine, well, what is the option that we have? We cannot accept to keep going back to the old ways when we do know that technology has an opportunity for us to democratize, to leapfrog, and we can lean in. And I think Nigeria can be that focal area, not only in the continent, but also in the lower income countries, to actually use these kinds of technologies to move forward. And we have seen the worth of such technologies in the context of COVID-19, which has pushed us all. And we've seen the application of genomics in terms of surveillance for COVID-19, in terms of upgrade of vaccines, because we know better the genomic sequences of the pathogens that are circulating. We also know that there are current efforts to develop things like Lassa fever vaccines, which are based on very good science and with genomic capabilities deployed. There are many of such pathogens, in addition to other non-communicable diseases, that genomic sequencing can help us to be able to do that. I think it's just 1 or 2 weeks ago, we launched the Institute for Genomics and Global Health at the Redeemers University in Ede in Osun State, where we had the world leaders on human genome Francis Collins, Eric Lander, Diane Wright, and many others joined our own Professor Christian Happy to really look at that robust institution that has the best human genome sequencing capability in the continent. Not only one, but two. And on the entire continent, I think we don't have that. So this strategy that we're launching, I think it's really that effort. I promise that we'll launch it, and I think we're actually acting on it as we speak. And we're committed to integrating genomic technologies into all aspects of our work. And the plan that has been laid out focuses on building our capacity for not only detection and surveillance, improving our response to emerging infections, and also advancing vaccine development. The AMR and the Genomics surveillance strategic plan are closely interconnected. You can see how one actually links to the other. And by integrating genomics into our AMR surveillance system, we can better monitor surveillance trends, not only for viruses like COVID, but also for bacterial pathogens. And we can detect threats. Recently, we did have some studies that indicated pathogens of pandemic potential in some fruit bats in one of the states, and a joint assessment was conducted. Now, the ability to really track these kinds of pathogens helps us all in terms of what we do. And together, these two strategies align with our vision for building a resilient and inclusive healthcare system for Nigeria as part of the African continent, but also as part of global security, where universal health coverage, digital health transformation, and innovative financing contribute to strengthening public health overall. Today, I can reaffirm the Nigerian government's commitment to the successful implementation of both NAPs on AMR, as well as the whole genome sequencing strategic plan. We will be investing more in the infrastructure as we're expanding our workforce, training our health workers, and enhancing collaboration among ourselves, as exemplified by the ministers that are here, but also with our international partners. And we will strengthen our public health system to safeguard the future of our nation. I think the president was very clear in his agenda. The fourth pillar is on health security. This is on the health security part of our blueprint and what we are doing. So I urge all stakeholders, local, regional, and international partners, to support the implementation of the strategic plans. Not only talk about it, but actually mobilize the resources. Put the resources where they're needed. We will do our part, but it's a public good. The benefit of it extends beyond the borders of Nigeria. So it will not be unsurprising if we see our external partners also as a good place to invest, because the investments here can help our neighbors, others in the continent, but also globally. And the extensive stakeholder engagement in both strategies, in a way, were yielded fruit because of the quality of the two things that we're launching. So in conclusion, I'm confident that the implementation of these strategic documents will position us as Nigeria as a leader in the fight against antimicrobial resistance and in public health genomics. I believe that in the next 2 years, there may be a high-level ministerial program on AMR, and I think we're considering Nigeria to host that, and we'll be making that plea to do that. We are building a future where every Nigerian will benefit from enhanced healthcare, improved disease prevention, and stronger health security. That is the renewed hope agenda that President Bola Ahmed Tinubu put forth, and we are working the talk. And so it is my honor to formally launch the second National Action Plan on Antimicrobial Resistance and the National Whole Genome Sequencing Strategic Plan. I will also reiterate what I started with, really thanking the DG NCDC and his team, the Public Health Department of the Ministry, and the entire set of stakeholders from our academia to civil society, to our development partners who have worked with us through this journey, through thick and thin, to come to this. But the real work begins tomorrow when we implement it. And so thank you also, Honorable Minister, for really taking the time to come. It's really great to have you join this. And thanks for your leadership, because I know during my time at the bank, you were also involved in the global effort through the IACG mechanism. So I really appreciate your presence here. And right, Honorable, when we come for our 2025 budget, I think you know that NCDC, just earlier this afternoon, in fact, I was discussing with the National Assembly about plans for our budget for 2025, and you'll be pleased to know that NCDC was very much part of that priority that we have indicated. So thank you very much. Thank you very much. Yeah.
So for photo effect of media, it's now time to, the minister needs to do the unveiling, please. Sorry. Okay. So we have the copies being shared. So let's have one copy each for the members of the high table primarily. Okay, that's fine. Honorable Minister, we crave your indulgence because of the nature of the stakeholders involved. We'll be happy to do it separately, sir. So we'll do the AMR NAP first. Apologies, because there are different stakeholders involved. It's all one head. So AMR National Action Plan first. Okay. We all have it? Okay. All right. Then we pick the National Genomic Surveillance Strategy. The National Genomic Surveillance Strategy now being officially launched. Congratulations, congratulations. So will definitely be made available at our different ministries, departments, and agencies. Thank you very much. Honor. May I crave the indulgence of the Honorable Minister to just have a closing remark and photograph. Can we please have our seats? Thank you very much, very distinguished leaders. The Minister is seated. Can we please have our seats? So that we can formally bring this event to a close. Thank you very much, very distinguished leaders in the room. With the permission of the Honorable Coordinating Minister of Health and Social Welfare to formally bring us the closing remarks for this great event is the representative of the Chief Veterinary Officer of the Federation, here represented by Civilian Director, Animal Health and Clinical Services, Dr. Musa Inua Mohammed. Over to you, sir.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. In the name of God Almighty, the most beneficent, the most merciful, our Honorable Minister of Health, Professor Bame Alipate, CON, representative of Ministers of Agriculture and Food Security, Dr. Ibrahim Tanimu, who is the Director of Planning, reps of the Federal Minister of Environment, represented by the Director of Pollution Control and Environmental Health, Mrs. Abubakar, former Minister of Health, Professor Onye Bochichuku,
Permanent Secretary, Federal Minister of Health, DG NCDC, our development partners, directors from the Federal Ministry of Health, Agriculture and Environment, our stakeholders, members of the press, ladies and gentlemen. It is clear to us today that AMR, that is antimicrobial resistance, is a global challenge. It's not only a Nigerian challenge, but a global challenge. Fortunately, Nigerian government or the world at large has taken that challenge to fight antimicrobial resistance head on. I will give you one small instance that happened to us just last month, sir. We had an outbreak of hemorrhagic septicemia in Taraba State, precisely at Mambila Plateau. So when we got the report, we sent our EPID officers to go to Mambila Plateau and determine what actually is the cause. About 15,000 cattle were affected. Over 1,000 had died. But when they interacted with the farmers involved, the story is better not told. There is hardly any pastoral home today you will go. They will not. If you see a pastoral man calling on you for services, he must have tried all he can, and there is no result. They cannot call a vet. So the issue of AMR challenge in this country is very, very serious. You only need to be in the animal health sector to know what I'm talking about. I had cause to have an issue in Borno State some few years back. We were doing community animal training. One farmer came with a very big bull. He was telling us that every blessed day, he gives 10 meals in house as a number goma. Every day, oxytate long acting. That time we had further in this country, they developed antibiotic that can last for 3-4 days to ease injection every blessed day. So he says every day he gives 10 meals of that antibiotic on the home. That's why the cattle is looking very big. He didn't mind the consequences. All he wants is to get a 14 bull, sell and get money. Who consumes this meat? It is me and you. Unfortunately, in the bigger urban areas, they can afford to buy the bigger bulls. So the abuse is tremendous. It's tremendous. However, the world has taken this challenge head on. Our donor partners are really helping us, and definitely we will not allow AMR to be the next public health pandemic. All stakes will be on deck. Everybody will do his own piece, and with the pronouncement by Mr. President on the possible creation of a federal ministry for livestock development, I assure you, sir, we are going to have better funding, and we are going to face AMR issue very, very seriously. Because we believe if you control AMR in animals, nearly 70% of our problem in that sector is almost gone. The egg we consume, the milk we consume, and the meat are full of residues. So at this juncture, time is far gone. I want to thank our donor partners, Federal Ministry of Health, NCDC, Agriculture and Food Security, Environment, the Press for Public Enlightenment, and on behalf of the CBO of Nigeria, Dr. Columbus Terubakuru, who is honorably absent, I want to thank everybody and wish you journey messages back to our destinations. Thank you very much.
Thank you very much. Thank you very much. Thank you very much, sir. So as we bring this event to close, Honorable Coordinating Minister, I've been told that we have the online participants across the globe who have joined us. So it's just for them to say bye-bye. Can we have the online participants? Is it possible? I don't think so. All right. We appreciate all the stakeholders, Africa Center for Disease Control, MSH, a long list of partners and stakeholders who have been part of this great event. Can we put our hands together wonderfully for ourselves for this great milestone in the history of this country? Congratulations to us all moving forward. So again, I will appeal, because the different support group for this event, we will have group photograph, 2 photos. The stakeholders for AMR, you please come behind and close around the high table. As soon as we are done, please, it's not time for pleasantries, please bear with us. You may please excuse so that we can have the stakeholders for here the genomic surveillance. So please let's arrange that quietly with minimal distractions. Stakeholders for AMR. It might interest us to know that the MC is part of the two group. I've worked ceaselessly on the two documents too. WR, you have to see. So for genomics surveillance, please can we leave for the genomic surveillance team? Genomic surveillance. Thank you very much and have a very good evening. I've been announced that we all get the copies in our friends' ministries and all our partners. You will all get your copies. Please bear with us. Thank you, everyone. Have a very good evening.